sciences is becoming a positive psychology. For a long time, psychology was abnormal behavior, what is wrong with the human, what is deviations in human behavior. Then gradually people realized that we need to also focus on people who are psychologically healthy but who need to be enriched. Their lives need to be enriched by the use of psychology. So positive psychology strikes a ray of hope to enrich the human life and the human mind and the human behavior. So these are some of the current thrust areas of psychology. Another area, or rather another point of emphasis which is coming up nowadays, is on the action part. For a long time, there has of course been fundamental research going on in psychology, but increasingly there is an emphasis on applying this research, taking it out of the laboratory and the classroom, and applying it in the life of the common man. And in this area also we have two of our eminent speakers. As I just mentioned, Dr. Ravi Rana will be speaking on adolescent psychology and problems, and Professor Ritu Nehra is speaking of today, which is women's issues in the 21st century. I am sure that with the speakers that we have and of participation and so many abstracts and painted, we are going to have very fruitful discussion and throughout the day. I hope it is going to enrich each one of us to take part in these deliberations and to be a part of these discussions. I hope you all have an interesting time, some important things to take away from today's conference, and I'm sure that certain points will emerge which will show us the path for the future, as the theme of our conference says, psychology and the road ahead. So that is what we have to establish, and I'm sure that we will have good conclusions from today's workshop and today's sessions, technical sessions, and the invited lectures. So once more, a very warm and hearty welcome to each of you for being a part of this event, and I hope that we will all enjoy the day. Thank you so much.
Thank you, ma'am, for a thought-provoking address sets a perfect platform for today's conference. Before moving ahead, I request Dr. Poonam Devdutt ma'am to welcome Sri Abhay Gupta, Managing Director, Dayal Fertilizers and Education Partner in today's conference.
I would like to extend a warm welcome to Mr. Abhay Kumar, Director, Dayal Group of Industries, who are our partner and who have been very generous in supporting in this conference. And in the course of this session, Mr. Abhay Kumar to also address the gathering for a few moments. He is an eminent industrialist and alumni of IIT Kanpur, and he has been very closely associated in he's past president of the Meerut Management Association and a great benefactor and philanthropist who's doing a lot of good work in Meerut. Thank you so much.
I request Mr. Abhay Gupta to address the gathering and give his blessings.
Thank you. About this all important seminar psychology here. And my best wishes, and I hope it will go a long way to helping professionals of psychology. And Shobit University to offer their to be partner of this important event. And I feel honored to be addressing this August gathering. The psychologists from all over India are present. I might say that I am a hardcore engineer and a corporate manager. And I would want to share my personal experience about my first encounter with psychology as an engineering student. While studying engineering at IIT Kanpur almost half a century ago, we had to study psychology as compulsory subject for 2 semesters as part of the curriculum. We all used to wonder that why psychology to engineering students, until I got into corporate world and realized the importance of psychology as a human science and also an integral part of management. In engineering, we learned the concept entropy and enthalpy and so on, importance of empathy, psychology courses, which later on came so handy in management while addressing the human capital issues. I only believe that emotional quotient is more or equally important to intelligence quotient in corporate management, which only the psycho studies can. With these words, I extend my best wishes to organizers and Shobit University for a meaningful program. Thank you for your time.
Good morning. First of all, I'd like to thank respected Vice Chancellor for inviting me to this university. And also I'd like to thank Dr. Poonam Devdutt for inviting me. And it's such a beautiful university. And I'd like to congratulate you for the inauguration of the new lab. I wanted to go with the theme of the conference, so I thought, what is it that I should present? And that's when I talked to Dr. Poonam, and she thought the topic was a good idea. Road to neuroscience. Before I proceed, I'd like to introduce to you psychology. So I'd like to introduce you to the clinical psychology at AIIMS. And this is the photograph leagues, including all the students. And so it's a big team that we have from AIIMS. This is talk, what is neuropsychology, how to become neuropsychologists, the differences between adult pediatric neuropsychologists, where neuropsychologists work, what their jobs entail, who refers patients to neuropsychologists, ladders toward neuropsychology profession in India, institutes providing courses in neuropsychology, WHO report on neurological conditions, rising epidemiology and burden of neurological conditions, prevalence rates of spectrum of neurological disorders in India, and some of the experiences that I'd like to share from AIIMS. Now, what is neuropsychology? As stated earlier, in the morning, the focus is on brain and behavior and its relationship. So, where do the neuropsychologists normally work? You want to keep the light on? Okay. So it's academic medical centers or hospitals where one can work. Usually, neurosciences or trauma centers is where you can actually use. Some of the areas, the primary medical areas you can primarily work with is neurology, neurosurgery, and neuropsychiatry. Of course, you can also have your private practice. Include some of the consultants from other agencies who can work very closely with forensic departments, the government departments, even me, the research organizations and rehabilitation. So who usually refers patients to us? A variety of referrals that we receive. Of course, as I said, which is the medical departments, which includes, for example, neurology, and then, of course, for example, endocrinology, and then other disciplines. How it has actually evolved in AIIMS is because AIIMS is not only a mental health hospital, it is a multidisciplinary hospital with 33 departments. So somehow the need came up and gradually the patients were being referred, and that's how it evolved over time. And sometimes the schools are referring patients to us for example, learning disability, ADHD, autism, etc. And sometimes there are self-referrals, especially elderlies who think that we are having subjective memory loss. And sometimes it's the courts who are sending patients to us. And we are part of medical boards, especially from, the courts around Delhi. So we need to very clearly have answered the questions which are addressed to us. And for that, we need to have comprehensive assessment, which includes, first of all, history. Then we need neuropsychological assessment tools and, of course, behavioral tools. To integrate all this data and need to provide some on our view on the diagnosis or what could be our plan, what we think may benefit the patient. Various centers in India, especially to begin with, it all started with law. And as I understand, about 54 years ago, a clinical psychology department came up in NIMHANS. To begin with, they have an integrated program with MPhil, where there are multiple disciplines, and neuropsychology is one arm. CIP Ranchi, again an MPhil program. RINPAS, which is an MPhil program, and PhD program at PGI Chandigarh. And IBHAS also is running an MPhil program. But at AIIMS, we are running an integrated PhD program, which of course was a need, and we were somehow, you will say, in that direction. Now, how neuropsychology became important. First of all, you should know that the WHO states about the burden of the disease. And I would state that although we talk about disability and we talk about different types of disability, however, all we assess through this was IQ. But when it came to a person who neurosciences or trauma center, this is a person, let's take it, who's met with a roadside accident, 324, who's already attained his maximum education. Then the person has an accident and the person loses his job. The person is never able to go back to his original profession. So giving just because the person was a high, used to sometimes give near average IQ. So there is no disability. Whereas there is a disability because the family members were suffering and he's a loan earning member. We had one example like this, a person who was working with Adobe and the loan earning member was not able to go back to his job and the whole family was suffering. So then we realized that 4 out of the 6 leading causes of disability or death are neurological in nature. So the major importance of neuropsychology. Then we looked at the burden of the neurological disorders and found by Dr. Gauri Devi, who was the director from NIMHANS and who also started the NBRC, that there's a major prevalence of neurological disability in India. Some of the common neurological conditions are degenerative diseases, diseases of blood vessels, injuries of brain and spinal cord, seizure disorder, cancer, infectious diseases, neurodevelopmental disorders, diseases by faulty genes. We need to address the question for which the patient is referred to us. So we need to have a diagnosis on neurodevelopmental disorders or adult neuropsychology. Again, we need to state having Alzheimer's or the person having Alzheimer's. So we need to have our tests in place to address the question for which the patient is being referred. So as I said, it evolved, and eventually at the Neurosciences Center, we thought how best we can do this was through three aspects: the clinical work, the research work, and the teaching work. Clinical is what the patients are getting referred to us for. And so this included working with patients, which was diagnostic formulation, assessment, cognitive retraining in brain functioning following brain injury, and psychological assessments, including various types of assessment procedures. This was done with also specialized clinics, which is two clinics, which is the Neuro Rehabilitation Clinic and the Cognitive Disorders and Memory Clinic. The Rehabilitation Clinic, we have eventually evolved, again, based on the needs of the clinicians or needs of the patients, and also assessment of disability. However, then, second most important aspect is research. Friends, I'd like to state, research is important because right now I'm sitting and talking to you, or standing and talking to you. I'm communicating to you. So when I'm communicating means, the communication has to be through publications. Unless it is published, you cannot be heard by anyone. So as a part of a multidisciplinary team, I've developed some copyrighted, patented material which was the patients, and also tried to publish some publications in index, national as well as national journals, including writing books, chapters. Then we moved on to the second aspect. This cannot be possible without there is a teaching program. For the teaching program, we have devised a program which is been assessed and looked at by some international neuropsychologists. And then eventually this involves a program which includes seminars, journal clubs, clinical work, number of hours, research publication, thesis, and focus on patented, copyrighted material. So the effective healthcare workforce planning was important, which included collecting data, which was again research and clinical work, form strategies, form plan, and also find out, evaluate, and understand the success. This integrated program, it follows the requirement of the patient, as I said, involved. Patients, institutes, students of the discipline view highly trained manpower, and that is how we evolved it. Constitution of aims, the research, clinical, and teaching for training. Hence, we developed a pyramid of everybody benefits through this to begin with the patient, and eventually can create an opportunity for people to find India. Some of the common referrals are: has the patient's medical condition impacted the cognitive functioning? Pre and post surgical evaluation for brain tumors or interactive with epilepsy. We are very actively working in the area of epilepsy surgery program. Is the reason for the patient's cognitive problems related to the medical or the neurological condition, or it is psychiatric in nature? So hence, that particular medical consultant will give medicines accordingly. Based on the patient's cognitive functioning, can they still live alone and manage finances, drive, etc.? If not, then we need to find solutions to that. The referral sources and questions vary a lot depending on whether you are an adult or a pediatric referral. So did this medical treatment impact the patient's cognitive functioning? Hence, what kind of treatment is the right effective treatment? We've actively also work with cardiology and cardiothoracic surgery. Sometimes the cardiothoracic surgery, there are certain procedures by which to have a cardiothoracic surgery, the patient's during surgery, body levels to be kept in minus something. So basically, how it works better, does it impact the cognitive impairment? Because the person would be able to socially interact. So it is very important and do something and find out which are the right procedures implementation. So the common neuropsychological was stated the cognitive domains, including lateralization and localization of brain function. As I said, we are a part of the active epilepsy surgery program. We are very actively working in the area of dementia and related problems, which is to make differential diagnosis. And we're doing pre and post evaluation of neurorehabilitation, which has been again devised by us, TBI, and also disability. Universe of cases that we are referred for is epilepsy surgery, the traumatic brain injury, tumors, stroke, vascular cognitive impairment, dementia, post-operative cognitive decline. Please remember, when a person is given an anesthesia, and if the anesthesia is given for too long, or certain types of anesthesia can actually lead to a cognitive decline. So we're working in that area as well. Looking at the aspect of multitasking, coming from a management school and hospital, you remember that many times people will give their CV and they say, I am a multitasker. Is it a good idea or a bad idea? We are working in that with scientific proof. Then we're getting referrals from trauma center, Gamma Knife, which features, and we've been part of a NIH project to look at if open surgery is better or a Gamma Knife surgery. Also working with neuropsychiatry. So as I said earlier, the GIST is an evidence-based assessment, which is and also we use these assessment procedures of neurological conditions. And we then eventually try and address how we have quality of life and restore and compensate the techniques through a approach. Typically, psychodiagnostic is a very important aspect for making diagnosis, for ethical aspects, and also for making a clear diagnosis. And hence, very important area is psychology, hence psychometry is important. So the mandate of the Institute of National Importance was to important branches of health to demonstrate high standards of medical education in India in all important branches of health. And as a consequence, coming from a tertiary care professionals, we conducted meaningful research and services from neuropsychological perspective to address the needs of all these multiple disciplines who refer the patients to us. International classification of functioning clearly states what is a good health condition is an equilibrium or a right balance between body, activity, and participation. Hence, the environment and personal factors are consulted, and you need to put all of them together to have a perfect life. As per 2014-16, now the new model around the world is CVA. Typical CVA is when you need to do a cognitive rehabilitation before you can assess the person's participation. Different reason for referrals, and hence localization is important. To begin with, I would state that there are various issues that are faced by traumatic brain injury, and it leads to the decreased quality of life, and it leads to post-concussive syndrome. Please remember that the major, there's a global burden of also stroke, and also which is stated in Lancet. And again, this disability is neurological in nature as per studies. And the major disability which is caused due to head injury is in Delhi, NCR. And this is so we wanted to look at the typical neurological conditions which may be. As we said, there are geno and phenotypes. If the children at the age in 20s do not eat green leafy vegetables, can actually have a cognitive decline when they are 45 and above. Similarly, that the kind of food that you eat and the kind of things that you do, it is very important that may impact later on in your life. So we are part of a Indo-Dutch cohort study in which we are assessing 15,000 persons, in which half of the people are from the rural background, and we are looking at assessing the aspect of this 5 times, and eventually we are to assess, eventually correlate this with the generations, which means their families. So we have made them like visiting card, and so we study that is on. Then we developed some screening tools because I do not know which patient they should refer to us. So they should be a cut off and they can refer the patient. So we developed certain tools for assessing cognition, for assessing dementia, and also for assessing preliminary aphasia screening, which is again assess the language. Neuropsychology at AIIMS is following a comprehensive process where the focus is on health, which is social, vocational, personal, cognitive, and family areas. We focused on assessment tools, developed certain tools, and also developed holistic rehabilitation packages in the area of traumatic brain injury. And also, since sometimes the people tend to mimic having dementia, showing dementia as a problem, whereas it is not, it is a personal problem. So through our assessment processes, we've created another rehabilitation package for dementia. And then we focused in the area of stroke because this was the third most visited and these are the patients who are being referred to us, and we developed a package. Then we focused on multitasking paradigms and improve it. Then we looked at, as I said, the disability form, the type of disability or the way that we were assessing disability in India was in, and we from AIIMS and as a part of interdisciplinary team, neurologists and everybody put together, we managed to have this term chronic neurological condition as a part of which has been converted in 2016. Then we looked at the disability model of dementia and also going beyond the neuropsychological assessment and rehabilitation. The idea is that we should be able to improve the person's functioning and also reduce the person's disability. So in short, it is a comprehensive neuropsychological approach that is being followed at AIIMS. Then we moved at community, and since the most important aspect, as was stated, is the biopsychosocial model, the screening tool that we developed from AIIMS, we took it to the mall, which is mostly visited by very young people and not the elderly. So we administered these screening tools on the young, and then we told them that if you can take it back home and you can administer it on your elderlies at home. And if they found a particular cutoff, as we taught them to, and so that they have some time to interact with the elderly, which is missing because of multitasking. And then we asked them to bring the patient to us by taking an appointment. So that's how we created a biopsychosocial model. And if there is any problem, we give a rehabilitative aspect is needed, taken care of by neurologist as a model, including developing cells and materials which we could give in the society, in the community, for them to again use the biopsychosocial model to bring them back to us. There's some amount of recognition, some awards that we recently on our work. We got nominated for the BMJ Award South Asia 2017. Sounds like fun, especially for those who want to take it up as a profession. So the road ahead is that you need to have a good bachelor's program. You need to have biology and neurosciences as a part of the program. You need to require to have good marks and good grades, and so that you are able to kind of have focus on higher universities. Some things that you need to focus on is that you should find a good lab where you can work, and you should be able to apply and focus on the efforts of the program that fits your interest and clinical research. And for a PhD program in neuropsychology, you can apply by focusing on which lab you want to work with and start working on it. But I must state that whichever you will eventually apply, they would not be expecting to be knowing everything about it, but you just need to know a little before you proceed. So a word about is there is a very nice recognized degrees like XI is giving a good recognized degree in MPhil. However, there are other institutes as per needs based and which focus adult, child therapy and testing, etc. But tries or is wanting to ever enter or focus on it. The ladders are that you need to apply as a short-term program during your master's program, and you need to apply through your head of the department to Dean Academics or the Director AIMS. The form is available, and then which includes the research orientation and the clinical orientation, where some bit of a package is given to the students to work on. However, we cannot hand over the patients to you, but we give certain normal, some additional research work to do. And through this integrated program, then eventually the person is able to focus on that work. In short, what is important is the purposeful and meaningful research and technology. Learning is the road ahead. I would like to acknowledge all the work that I have shared with you to DST, Department of Science and Technology, for their financial support, my CNP, Clinical Neuropsychology team, the patient's participation, and also the AIMS who are providing facility and all the referrals that we have. Please remember, we are non-medical, clinical medical doctors, unless the medical doctors refer the patients to us. So it is a group, it is basically a team that we are working on. My team of clinical neuropsychology at AIMS, these are my students, my children, who are my scientific. Thank you very much. Before I go, I'd like to say to the students, you treat a disease, you win, you lose. You treat a person, no matter what the outcome is. Thank you very much.
Thank you, ma'am, for giving us valuable insights on neuropsychology. Now we request Dr. Mehra to address on issues in 21st century.
Good morning,
And thank you very much to the organizers, to the chancellor, and to a very dear friend Poonam Deva. When Poonam said that I would like you to come here, I just grabbed the opportunity, and she has given me a very good opportunity to meet you, interact, and address you people. And I will say that university students are lucky to have a teacher like Poonam Deva. We are class fellows from postgraduate level, a brilliant student of Punjab University. Still, her name is, mentioned there in the department. A student like has not probably come. And if you are taught by her, you are very, very lucky. We used to look at her copies, used to peep into what she is doing. She said that at her institute and universities at infant level, if the infant level is this today the hall is full and she's conducting her first conference in the first year of the university. I don't know by the time you will be at adolescence level what will happen. So all the
Thank you so much.
no, you deserve it and you have done it. Very happy to be here. And she's given me a topic about women's mental health in the 21st century. I have not talked much ever, but I think we have experienced it more. Jawaharlal Nehru once mentioned that a country's status is known from its health. It has come up a long way and gained a good position, I can say, being women. But to gain this position and this status, I think we are playing a big. And what is it? If you look at this picture, what can you see? Can anybody tell me what is it? Students? Pardon? It's a superwoman. It's a picture of a superwoman, a woman who can do everything, right? She is a goddess, she's a provider, mother, daughter, professional, perfect in everything. She's no more dad who's giving just birth to children and taking care of them. And that's it's giving us a value these days. It's a moral value for a woman now to have this kind of doing multitasking, a superwoman in every field she is there. So women in the 20th century are expected to fulfill multiple roles, which are family-oriented and career-oriented at the same time, leading to changing in the gender roles. No more, and different forms of stresses are there now for her. It was earlier in the traditional role she was taking care of children, and those who were from the low socioeconomic status were working not only but rather going and working in the houses of other people. And again, that their wages, their payments were in comparison to men. Nearly 70% of the population in India, and even in urban areas, many women will continue the same traditional role, which is limited to home, even for higher education. Today, we are sitting in an urban area in places where we have all the facilities, but still our rural population is facing the same problem. The trend is changing, globalization is taking place, education is available, new universities, new colleges, new opportunities are there. And a lot of social media is playing a role, We can see that now a woman feels that her image, her self-image should be better than others also. So that's causing awareness to come. So now there are more opportunities to study, go out of home, take up jobs, and compete with the opposite. But she has to still maintain a balance between home and work, which is still not there for men probably. It is for her that she has to maintain. At home, she has to do her duties. She has to look after her family. At work, she has to think about the growth and accomplish the goals which are given to her. At the same time, her self-image is important for her, that she has to keep on proving herself. And that's a source of fulfillment. That's how she keeps herself at a place. And in the current scenario, women are faced with a double-edged sword between home and work, or expected to maintain every precarious routine. So all this is leading to what? Anxiety and stress in the life of a woman. For a woman is that taking care of family is of importance to her. She's there in the back of my mind that my family is important for me. So which is considered her duty by the woman herself. Not developing a career leads to poor self-image, and work demands can prevent from spending adequate time at home, leading to a guilt feeling in the females. At the societal level, again, the concern is if woman is working, she's accused of neglecting their family, their husband, their other jobs which are assigned to them by nature. And if they are also told that that they have no ambitions if they have only to take care of the household. Now, this is a urban area woman. If you're not working, then also they have problems. So at the same time, we see in our jobs, the job regulations are imposed which prevent maintaining a balance. So all this leading to what? Stress, stress, stress. And what symptoms do you see when there is stress? Now, a woman who's working at two places, what stress is there? What kind of symptoms you will see in them? Come on, whatever comes to your mind, you can say, then we'll go about it later.
Anger,
Yes.
frustration, imbalance of emotions,
Yes. What else? Is irritability. Complaints of pains and aches. Which is, and many people don't even get to know about it, women is understanding where the problem is. So causes of stress are at biological level because of the life of the female. There is at menarche level, you do experience body hormonal changes are there leading to irritability, anger, and again signs of so low self-esteem in them at that time. Pregnancy is always a difficult thing for a woman, but she carries on very happily about it. Then childhood birth, which leads again lot of difficulties. There are postpartum blues, which we say postpartum depression is there with these females, and at the time of menopause, again she experiences lot of changes in the hormones, which leads to depression at that age. At home and in environment, we all have seen there is a sexual abuse, both at home, both at workplaces. You're talk these days. You're hearing Me Too a lot. I mean, I shouldn't talk about it much over here, but that's what is happening. That it has been happening, it is happening, and still going on. And domestic violence, you can see. I don't know, more than 15% women will report, may not come and talk about it, but they will report that yes, they are being beaten by their own people at home. At work also they are abused. And there are biases, gender biases are there. Women are given different kind of jobs as compared to men. There is a lot of harassment at work which leads to again tension to them. And other are gender bias, drug addictions which is coming up with problem. It's because of the stresses they are also moving for it. Trafficking has always been there. So to endure stress, even in the womb, they were unwanted on her side. At the time of pregnancy and child postpartum and postpartum blues and depression, I don't know how many of you know, but it is there within 6 weeks, they feel it's difficult when the birth of a child takes place that they feel, oh, I will not be able to go back to the work now. I will not be able to do like I was free person earlier, or not able to take up the job seriously now because I've got another thing in which I am involved. And postpartum depression, a lot of responsibility is there along with it. Women are one who will suffer the maximum autoimmune diseases, and hypothyroidism is one which is most common among them. As I said, at menarche, there is a problem with girls, and in childhood, they are neglected in comparison to boys at home. As they grow old, they are having disease, which is again, there is a big neglect among females, and they are not even taken care by many in the family, and she keeps on working with her problem. I can see man smiling as if everything is happening around her, all this. So home, at work, as I said, there is the gender bias. It really seems that women are not preferred when they are taking them for work compared to men, because men are more skilled workers than women. Neglect from your own loved ones, they are target to abuse and dowry cases, we have heard beating cases, we have heard abuses, and sexual abuse is always their family members, close relatives, and at work also. Of opportunities to women that this kind of the work will be given to you. You cannot come late at night, so you will not be assigned this duty. Glass ceiling for women. It's glass ceiling is that beyond this there are no opportunities for women. You may say no, it's not like this these days. It is happening now, but the percentage is very little, you can say. And then there is a denial of medical and maternity leave. Government has done a lot, I will say, as if things are improving, but there are problems. In private sector, still you will say that people will say, come back after a month or two and work. It is not like government sector and not in all places that you get leave for maternity and so victims of sexual crimes and slavery are women, and in spite of they are reluctant to report because they will say, no, we are financially dependent, I will not report. I'm still attached to my husband, I will not report. These are the problems, I will not report. The women will not speak about their problems. It is difficult to lead an independent life for a female. Still, it is bad. You're all from a different category. If you go and people in the society that are not literate and they're still in the rural areas, things are different. At home, you cannot express about your needs. You cannot go with your own choice to study also that I want to do this. So you will not be given a freedom. Still, you will be guided for it. At work also, and again, even for this, they want to speak about, no, they cannot. Whether they want it or they don't, I'm not given that. So what happens due to this? What happens? Right?
लाइक जो हम लोग मतलब जो चीज हम लोग करना चाहते हैं वो हम नहीं कर पाते उसके बाद हमारे फ्रस्ट्रेशन जो उथल पुथल जिसे कहते हैं मन में
Yeah,
बहुत
that's right. So क्या होता है? What did you say? Okay, that's right. Yeah. Okay, it works. So it has an effect on your work. No man knows that what happens to a woman when she is undergoing stress. Boys, come on, speak. Sure, I would love to hear that. So all this more stress leads to what? Being a mental health professional, I will talk only about the mental illnesses. Most of the students are here from psychology and psychiatry, so I'm not touching upon other things, only about the mental health. So mental illnesses and many types of mental illnesses, especially anxiety, depression, and somatic symptoms, which I said pains, aches, here and there, more prevalent in women. And it is possible due to the which is faced at different stages of their cycle. They are always faced, what I can see. Depression has been seen as one in suffer from at least one episode of depression in their life. Very common in women, but also it's more persistent in the case of men. Probably it will go away when they are indulging into different things, but it will, which is more dangerous and bad for them. Women are likely episodes in their life, and medical disorders such as hypothyroidism causes them, increases the risk. Many of you will think that it's such a illness, hypothyroidism, but if you have hypothyroidism and along with this, the chances of propensity to develop depression is definitely more. And there is a high risk in pregnancy as there are postpartum depression and postpartum blues over time. Another is anxiety, which is most common being generalized anxiety disorder, which is twice they are likely to experience in comparison to men. And obsessive compulsive disorder has high rates, which leads to high levels of disability and poor quality of life. And 60% of people with OCD and phobia are females. Suicide is more common because of the stresses. Again, one, they have the sources being at home. Either they will burn themselves, they will take this flush cleaner or self-poisoning or hang themselves when they are not around, so nobody's around in the family. So women attempt suicide twice more than as compared to men. And in countries like India, successful, leading to one of the highest suicide rates in the world. Psychosis, you have probably read schizophrenia, bipolar diseases you have heard. So these are their leading to poor quality of life, inability to work at home and outside. And again, the course of illness symptoms in this are different than men because probably need harmony different than them. They are wired brain-wise also differently than it has been established that their brain structure is different. So they suffer more from these diseases. And the sad part is again in our country, people will not take them for the treatment. They don't want to spend on female because her task is just to work at home and do that. And now with all these stresses and strains, they are taking more drugs also, and which is again becoming difficult for treatment in case of females. So there are psychological problems with women which are associated with lot of stigma and prejudice with it. A simple case, a 22-year-old woman who was pursuing MA, she was married for 6 months, and over next few months, she began to remain depressed, would hardly talk to anybody. She was brought to the hospital after she consumed all the medications at home. She tried to make an attempt. And at home in order to end her life, and further inquiry revealed that her husband would drink alcohol every day and would beat her, would not allow her to go out of the house or study, and she was told by her in-laws that she only needs to do housework and have kids. So that was all that was expected of her. So they would not listen to her protest, and her own parents refused to interfere. You are buddy. I know you don't know much, but just guess what you will do in case coming to you like this. What? Just to stimulate you, otherwise you will sleep.
Any responses from psychology students?
एक लेडी आती है जिसकी ये प्रॉब्लम्स हैं, उसने सुसाइड कमिट की है, या आपके कोई नेबरहुड में ऐसा होता है, तो क्या सजेस्ट करोगे आप? करना?
फर्स्ट ऑफ ऑल तो उसे ही हमें थोड़ा अवेयर करना पड़ेगा कि नहीं सिर्फ इसी चीज के लिए नहीं होता, तो सबसे पहले उसको ही अवेयर करना पड़ेगा, फिर उसकी फैमिली को, फिर उसके जो पेरेंट्स हैं, उसके बाद उनको धीरे धीरे सबसे पहले जो स्टेप होगा वो उसी के लिए ही होगा कि तुम्हें ही आना पड़ेगा, तुम्हें ही इससे बाहर आना पड़ेगा, तभी ये हो पाएगा, वरना नहीं हो पाएगा.
That's wonderful you have thought of it, but being a first year student, you should be referring them to the hospital, to the psychiatrist. It's good. You will do that once you become a psychologist or a psychiatrist. But you have to refer them. Yes, here is a person who's crying for help. When you're committing suicide or you're making an attempt, it itself indicates that there is a need for help, you know. You need help. You're crying for help. You may not be really wanted to commit suicide, but you're attempting so that people look at you. So this patient was diagnosed to have moderate depression episode, and she started on an antidepressant, escitalopram, and advised to undergo therapy, for which they both husband and wife came to us, regular follow-up, approved with it, you know. And then after a short while was home, and over the next few days began to show improvement also. So the comes for a marital therapy regularly after that. A 32-year-old woman was brought to the psychiatry OPD by her husband, birth to her baby, a girl, 3 months ago, and soon after that, crying for most of the day and would refuse to take care of her baby, to have postpartum depression and advised medication and rest. Patient was reluctant for the same, and she was working in a multinational company, and her maternity leave was over, and was afraid that further leave would not be sanctioned by her manager. So these are the problems when they are having more stressful and leading to depression. And it's very common these days we see in a postpartum depression. Earlier it was not so much, but now it has increased because of the dual role again. So this patient was diagnosed to have severe depression, and she was again advised ECT, electroconvulsive therapy, and antidepressants, and patient and family members agreed for the same, and treatment was started on this patient, and she recovered completely over the next 3 weeks, started taking care of baby, and was returned back to the zoo. So we need treatment for these people. We cannot just ignore them. So the consequences of all this is that we can see is a neglect of women, and when they are often not taken for the treatment. So being budding psychologists, please refer people. That's the community services you are doing. We will see many a times on the road, you will see in a bad shape, roaming around on the roads. They are homeless, they're being abused. Violence are common as they are unable to fight over the. So what to do? As I said, first of all, you need to have awareness and then create awareness. Education of women about their own rights, being awareness of rights and resources which are available, the capacity to fight exploitation and injustice. Education will also lead to better chance of economic independence of our people. And not only that, you need to make men aware about the rights of women and giving them equal opportunity and respect in the society. I always say that why there are so many cases of rape and other things around us, because someday when children are small at home, we keep on telling girls to be cautious, we keep on telling girls to behave like this, but we have never focused how our sons should be behaving. We tell them, तू रात को घूम सकता है बाहर, नहीं लड़की तू शाम को 6 बजे वापस आ जाना अंधेरे में. Why we never taught our sons? And now I think it's time, it's high time, we should start telling them how they should be respectful to a woman, so that they also change their minds and not be so abusive and violent about women.